Good afternoon. Welcome to Wednesday's Inside Look by Brooks. This is our second Wednesday we're doing this, and we used to be on Friday, but Wednesday seems to be the better day because a lot of stuff happens during the middle of the week, and we want to get the news out there. Today, I'm so excited to have Dr. Hamtaee. Could you introduce yourself to the audience?
Sure. My name is Dr. Hamtaee. I am with Spine Correction. We have two locations, one in Dundee, Florida, and we recently opened a second location in Sebring. I grew up in Winter Haven, actually. I'm a hometown boy, I guess you could say. And
Dr. Hamtaee sees a lot of our clients, and I've been to him personally. I speak highly of his skills as a chiropractic physician, and we enjoy working with you, Ali. It's been an honor and a pleasure to always, and the clients get great feedback from their visits with you and your staff, and you're always so professional in the way you deal with people. So I wanted to kind of, I see you brought some stuff with you today. What did you bring with you?
I brought a spine of a human,
Okay.
a model of a human spine, and I brought a couple of vertebrae, and it shows the disc. Then when you're ready, I can explain it.
Sure. So I grew up in a physician household. My dad was an internal medicine physician, and I come from a long line of doctors. My grandfather was an OBGYN. I had an uncle who was a neurosurgeon, another uncle was a surgeon. And so we had medical doctors throughout our family, never any chiropractic physicians. And it wasn't until I started practicing personal injury law that I became familiar with the key role that chiropractic physicians play in diagnosing and treating auto accident injuries. A lot of the medical doctors are great at diagnosing internal issues and colds and flus and diabetes and things like that. But a lot of the time, your family doctor won't see a traumatic injury in their regular practice. And I found that chiropractic physicians are on the front lines of those kind of injuries and do a great job of figuring out whether it's going to be a soft tissue injury or something more serious like a herniated disc, and they can then refer it to the appropriate medical doctor. So I've come to appreciate the role that chiropractic physicians play in not only diagnosing what the extent of the injury is, but treating that soft tissue injury so that the pain goes away. So tell me a little bit about your, where did you go to chiropractic school?
I went to chiropractic school in Dallas, Texas, Parker College of Chiropractic.
And just how many years is that? And then was that after college?
Correct. So 4 years of undergrad, 4 to 5 years of undergrad, and then 4 more years of chiropractic school. And with those that graduated around my time in the state of Florida, we took 5 national boards and 1 state board.
Wow. So that's 8 years of post high school studies, and a lot of testing. And so tell me, in your mind, I know that your practice, you tend to focus on auto accident injuries.
Correct.
And why did you choose that over more of a general practice?
Actually, coming out of school, my father recommended that I actually work with somebody versus opening my own practice. And that's what I did. I did 3 interviews, all went very well. I chose the one that I thought was best for me. It happened to be in a personal injury setting. I actually fell in love with it. I love treating patients. I'm a very personal type of person. And treating those patients, we had patients that got hit by cars, physically, pedestrians that got teeth knocked out, and just a list of injuries, and we treated those injuries, and we always got them better. Now, there was a group of doctors, so I would treat one thing, and if I needed to, I would refer, and that doctor would take care of whatever injury that was that they were specializing in. So
okay, yeah, well, that's great to know. So when an auto accident victim comes to you, what is the first thing you do? What are you looking for?
So the first thing, well, we go through a thorough history. They tell me exactly what happened. It usually almost always, not always, but very often it relates to the spine, because very often when they get hit, and it's more common than not where it would be a rear impact collision, you get the whiplash. And with the whiplash, not only do you get in the neck, like most people think, but you get it throughout the entire spine. So we go straight to the spine. Now, obviously, whatever they complain about, we address, but typically, almost always, it's a spinal issue. We go straight to the spine and find out exactly what the problem is, and then we go from there.
Okay, you want to kind of go through the anatomy there?
Yeah, so this is a spine right here. We have the cervical spine, which is comprised of 7 vertebrae. Then we've got the thoracic spine, which is comprised of 12. And then another 5, the lumbar spine, the low back. Now that's 24 vertebrae that comprise the human spine, the adult spine. The adolescent infant spine is actually more vertebrae, but down here they actually fuse. The sacrum becomes one solid bone. It in an infant is actually 5 different vertebrae. It ends up being one as it fuses throughout the time.
Interesting. I did not know that.
Yeah, and then same thing with the sacrum. That actually is 4 vertebrae that ends up fusing into one. So we've got 24 vertebrae and 1 sacrum, 1 coccyx, where in the child it's 33.
So whiplash is typically in the cervical region?
Correct.
Here.
So when they get hit, let's say in the back, a rear impact collision, they go forward and their neck snaps back. That causes almost most, I would say most people, not everybody, but most people, it creates an S curve. The vertebrae gets shifted out of place. It pulls on and stretches the ligaments and tendons beyond what they're supposed to be. So you get micro tears all throughout. You've got 6 layers of muscle that attach to the spine because it's that important. And that's what it does. On top of that, it can cause a herniated disc, which is what this is. It will, in different ways. This, just to jump to this right now, this is let's say this is the low back, L4, L5. There's a disc here. That disc is like a jelly donut. This is a cushion, a shock absorber. What happens in a whiplash type injury and other types of injuries, but very often in a motor vehicle collision, it will actually herniate the disc. So it will compress
and push the disc out.
And it will push the disc out like this, and it can hit that nerve right there that can cause a plethora of problems.
Okay. Now, we hear a lot about epidural injections, and as I understand epidural injections, when that disc pops out, there's some fluid released that can irritate the nerves?
Correct. So what happens, there's 2 parts to this disc. There's an annulus fibrosus, which is the outer part. It's like the dough part of a donut. And then you've got the nucleus pulposus, which is the jelly part of that donut on the inside. And what happens is when that gets squeezed out, it can hit that nerve. And depending on what part of that nerve, it can cause, again, a plethora of problems.
And so with an epidural injection, that kind of negates the inflammation that the jelly donut causes.
Correct.
To give the disc time to reabsorb?
But hopefully reabsorb. But what the injection usually does is try to help with the inflammation to decrease the pressure on the nerve.
So at what point do you send a patient to a surgeon or to a pain management specialist for either an epidural injection or a potential surgery?
So we take care of all these patients. Even if they do have a herniation, we continue to co-treat with them. If there is a herniation, I always 100% of the time refer out. A lot of times the surgeon refers back and says, this is, you're doing a great job. You need to continue to take care of this patient. I don't need to. If they do feel like they need to do surgery, that's really in the surgeon's hands and the patient's decision, really. And between them, they can decide if that needs to be done. As far as pain management, if we can't control the pain, and again, we often do, we again can co-treat with that, and that's when we refer out to a pain management specialist.
And that's what I like about Dr. Hamtaee. You can always tell a good chiropractic physician is a team builder. So if he feels like he needs a team of pain management specialists outside of his scope, or a surgeon, he is not afraid at all to incorporate them into the treatment plan for that patient. And he has no ownership. He just wants to get that patient well. So typically with an auto accident, whiplash, that maybe where there is no herniated disc, how soon can that client expect to see some pain relief with the chiropractic help?
Some pain relief, often it's usually right away.
Okay.
After the first visit, the first manual adjustment, they usually feel at least a little bit of relief. Sometimes it takes time. And as you know, oftentimes until they get completely better, it can take months. And less often than that, sometimes it takes years.
So in Florida, we have a 14-day rule about treatment. Can you go over that?
Yeah, a couple of years ago, somebody passed a law where you have to be seen within 14 days to take advantage of your personal injury protection benefits. Unfortunately, I've had patients come in on day 15 and the insurance companies, from what I've seen, never give them the option to actually use it. So 15 days and it's over, you've lost your benefits. And I strongly recommend you seek treatment, even if it's just to get checked out. You may not necessarily be in much pain. You may actually not be injured at all, but you want to get checked out within that 14 days because that gives you ability to continue if the next day you wake up and you're in horrendous pain and it was due to the car crash. So.
Yeah, I actually talked to a client this morning that was in an accident yesterday, and they were saying, well, I'm not really in any pain. Should I get checked out? And I'm like, when you're in an accident, you got that rush of adrenaline, and sometimes that can cover up pain, and you don't feel pain for a day or two or even longer. So just like Dr. Hamtaee said, it's important when you're in an accident, even if you feel no pain, to get to a doctor to check out, to see what the level of your injuries are. Because in all likelihood, in 2 or 3 days, you are going to start to feel some pain. And the longer you wait to see a doctor, the more fodder you give to the insurance company to argue that the injury you're experiencing was not caused by that particular accident, because they're going to argue, you waited to see a doctor for a week. How come? So it's always important to get checked out right away.
And to add to that, being a guy, most guys want to be the tough guy. They want to wait. They think after a few days it's going to go away. A few days becomes a few weeks, and by that time, the 2 weeks, the 14 days is over, and then you've lost your benefits. I've seen it very often. A lot of times it may not be pain, it may be tightness. Just that bit of tightness can create more problems down the line. It's just the start. So it's always better to be safe than sorry. Get checked out.
Okay, that's great advice. In closing, is there anything else you would like to tell the audience, or?
No, if something ever happens, our office is always open. We'll answer any questions, whether it's in person. My door is always open, whether it's in person or over the phone. You can reach us. Our phone number is 863-438-2772. Our website is www.spinecorrection.com. We are always open and willing to help in any way that we can. I do have a wonderful staff. I'll put my staff up against any staff out there. My staff is very welcoming. Every person that works at the clinic is very much a friend, almost like a family member, and they're willing to help. Anytime anything ever happens, we're always here if we can assist. So.
Okay, well, thank you so much for joining
Absolutely.
me today. It was a great pleasure, and you're always very informative. And so we'll see you next Wednesday at 12:30 for Wednesday's Inside Look by Brooks. As always, if you have any questions, legal or otherwise, you can email me, steve@brookslawgroup.com, and I'll get back with you. And until next Wednesday, have a great weekend and enjoy yourselves and enjoy your Christmas shopping. Thanks for joining.